Hello, in this video, I'm going to tell you all about high intensity interval training, also referred to as HIIT training. So HIIT is a form of interval training that combines aerobic and strength exercise. Now, there's all sorts of different ways to do it. You can do it exclusively using cardiovascular exercise. So like you could do sprint training, or you can be running, you could do it on a rowing machine. So you could do all sorts of aerobic HIIT, and you can also do HIIT using strength exercise. So like body weight movements or kettlebells or all sorts of different things, or integrate both. It's the intensity is very vigorous to achieve the same benefits of a more moderate but longer workout. So it's sort of like if you take an hour-long moderate intensity workout and just cram it all into like half an hour, now it is a vigorous workout, and that's what we mean by high intensity. So HIIT involves several rounds of exercise that alternate between longer rounds of high intensity followed by shorter rounds of low intensity. And now longer rounds of high intensity when you get more advanced at applying HIIT, but I'll give you some guidelines and things for beginners, intermediate, and advanced HIIT exercisers. So a 30-minute HIIT session is considered a complete workout. So assuming that you're following the guidelines where your high intensity intervals are 80 to 90% max heart rate, and your low intensity intervals are 60 to 70% of your max heart rate, then if you do that for about 30 minutes, then that is considered a 30-minute vigorous intensity workout. Now, the general recommendations for your weekly amount of exercise is either 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise spread out over the week. So a 30-minute HIIT session means that you can achieve that 75 minutes of vigorous exercise in just 2.5 workouts per week. So if you're doing it 3 times a week for 30 minutes, then you're exceeding the minimum requirement for a healthy amount of physical activity. So if you're a beginner and you're just starting to explore this idea of HIIT, then I recommend to use 60-second high-intensity intervals alternated with 90 seconds of low-intensity intervals. Now, research has shown that you want your high-intensity intervals to be at least 1 minute long to achieve the maximum benefit. So as long as your high-intensity intervals are at least 1 minute long, and your low intensity intervals are brief enough that you're not fully recovering. Like you don't want you don't want your heart rate to get below 60% of your max heart rate when you're in those low intensity intervals. So for a beginner, generally speaking, 60 seconds high intensity alternated with 90 seconds low intensity is a really good place to start. Then as you get more practiced at HIIT and you're getting into better condition, then you can try out the intermediate level, which is about equal. So about 60 seconds high intensity and 60 seconds low intensity. And then as you become more advanced, then you can double your high intensity intervals to about 2 minutes and alternate that with your usual 60-second low intensity intervals. Now, that's just an example to give you an idea of the ratios between high intensity and low intensity. But you can do it all sorts of different ways. Like at the beginner level, it could be 2 minutes of high intensity alternated with 3 minutes of low intensity. So your intervals can be longer, but this ratio that I'm presenting here is appropriate for each of those different levels. All right, so some of the benefits of HIIT. So number one is that it's very efficient. So you can get a lot more work done in less time. So like I mentioned, you could take like a moderate intensity hour-long workout and you're sort of condensing that into a 30-minute workout. So you're getting the same work done and achieving the same physical benefits, but in much less time. Another benefit is that it can be done with body weight only and doesn't require a lot of space or equipment. So you can do this right in your living room just by alternating, squats and burpees and different sorts of body weight exercises to get your heart rate up. So it isn't really about the type of exercise that you're doing. It's about how vigorously you're doing it. So how high is the intensity? So if you wear a heart rate monitor, it could be an Apple Watch or whatever it is that you're using to track your heart rate, you can get your heart rate up into the ranges that I just discussed doing just about any type of exercise. And that's a really big benefit here. So it also has all the same benefits of any other type of exercise. So it can help decrease body fat, increase strength and endurance, improve your health. The benefits will be more specific to whatever type of HIIT you like to do. So like if you're doing running only, then that's not going to have as big of effect on improving your strength as it would be if you're doing body weight exercises for your HIIT. That's going to have a bigger effect on your strength. So depending on which specific exercises you use, you'll get different benefits, but the same benefits that you would get by doing that form of exercise in a format that's not HIIT training. So HIIT is not inherently more beneficial than any other form of exercise. It's just that you can get it done more quickly. So it's more efficient, it's more flexible, more versatile. So there are all these benefits of HIIT. It's not going to be better for your health than another form of training, but you get to take advantage of all these other benefits, and it's equal for your health as all these other forms of training. Now, with that said, there are a few precautions that I need to discuss here. First off, it's not appropriate for anyone who cannot safely exercise at 80 to 90% of your maximum heart rate. So if that is not safe for you for whatever reason, then HIIT is not going to be an appropriate style of training for you. If you're currently deconditioned, then I would say avoid HIIT for now as you kind of get back into the swing of things. So you don't want to go from being completely sedentary and not exercising at all to suddenly HIIT training. It's a lot. So get back into things more gradually, start to recondition your body, and then when you're ready, then jump in and try HIIT training. Also, if you're recovering from any injury or surgery or anything like that, it's not time for HIIT yet. If you have medical conditions that are monitored by a physician, so like diabetes or heart disease or any condition, or you're over the age of 60, then I highly recommend that you talk about this with your doctor before starting a HIIT program. And again, even if your doctor approves of your HIIT program, if you're currently deconditioned, I still recommend kind of starting gradually with different forms of exercise and work your way up to trying out HIIT. Also, if you are doing HIIT training, make sure that you're paying attention to how your body feels while you are training, especially if you have diabetes or heart disease or some other condition, because your blood pressure could potentially drop, your blood sugar could drop. And so just make sure that you're sensitive to that and paying attention to how you're feeling and stop immediately if anything is feeling strange or uncomfortable. All right, thank you so much for watching this video, and I'll see you in the next one.